Choline is a macronutrient and is important for liver function, normal brain development, nerve function, muscle movement, supporting energy levels and maintaining a healthy metabolism. Choline is present in the form of phosphatidylcholine, a compound that makes up the structural component of fat, and thus it can be found in different types of foods that naturally contain certain fats. Choline plays a part in several important processes within the body that are carried out hundreds of times every single day. Choline is a water-soluble nutrient and is related to other vitamins such as folate and those in the B vitamin complex family. Just like B vitamins, choline plays a similar role in terms of supporting energy and brain function, as well as keeping the metabolism active. Many people advise stacking a B vitamin with their choline supplement and their nootropic for the best effect. Choline helps in the process of methylation, which is used to create DNA, for nerve signaling and for detoxification. It's also important for the functioning of key neurotransmitters called acetylcholine, which similarly help nerves to communicate and muscles to move, and act as an anti-aging neurotransmitter and performs other basic processes. Choline was actually only added to the National Academy of Sciences required nutrient list in 1998, making it one of the most recent additions of all the nutrients. Women above the age of 14 should have around 425 to 550 milligrams per day, and men above the age of 14 should have 550 milligrams per day. Some experts recommend getting even higher levels of choline in order to boost brain function and to retain memory. Some reports have shown that a percentage of the choline found in food sources isn't actually absorbed by the body, and this is one reason why certain people can experience a choline deficiency, especially those with liver damage, since choline is processed partially in the liver. Symptoms of a choline deficiency can include low energy levels or fatigue, memory loss, cognitive decline, learning disabilities, muscle aches, nerve damage, mood changes or disorders. A choline deficiency may also play a part in age-related cognitive decline, including memory loss and Alzheimer's disease. This is because choline helps with neurotransmitter maintenance, and as someone ages, nerve signaling can decrease and signs of dementia can be experienced. Choline helps the body to absorb fat, and fats are then used to create cell membranes and structures. Without enough choline in the body, our cells cannot properly withhold their structure and signal messages to other parts of the body. One of the main benefits of choline is that it's used by the body in a variety of ways that are crucial for nerve functioning, including aiding in nerve signaling and maintaining the membranes of brain cells. Choline also helps to form tissue within the nervous system, and this plays a part in brain development and growth. It's believed that choline can improve signaling capacity of the nerves, supporting their structure, integrity, and protecting vital neuronal membranes. Choline acts like a precursor to certain important neurotransmitters, including acetylcholine, which is used in healthy nerve and muscle function. Neurotransmitters are chemical systems of communication used throughout the body, constantly to relay information from system to system. The neurotransmitter acetylcholine specifically plays a part in memory and learning, so a choline deficiency can result in poor concentration, poor memory, mood changes, and other cognitive impairments, especially as someone ages. As we age, our brain becomes less elastic. Choline does an important job of maintaining brain elasticity by working to maintain levels of acetylcholine, which naturally declines in old age. Some studies point to the fact that low levels of acetylcholine may lead to cognitive decline, including Alzheimer's disease and senile dementia. Patients who develop Alzheimer's at times show very low levels of acetylcholine, and some medications used to treat Alzheimer's actually mimic choline's effect of increasing this neurotransmitter. Huperzine A is used to improve memory and mental function in people with Alzheimer's disease or other types of dementia. It's also used as a study aid. The Huperzine A inhibits the breakdown of the neurotransmitter acetylcholine by the enzyme acetylcholinesterase. Although effective as it works by preventing the breakdown of acetylcholine, it would only be recommended as a short-term study aid to increase the choline levels. The more sensible long-term option would be to supplement with a food source of choline, such as CDP choline or alpha-glycerylphosphocholine. CDP choline activates the biosynthesis of structural phospholipids in the neuronal membrane. It increases cerebral metabolism and it acts on the level of various neurotransmitters. Thus, it's been experimentally proven that CDP choline increases noradrenaline and dopamine levels in the central nervous system, as well as supplying the brain with choline. Some people think choline bitartrate works and they buy it as it's cheap. However, it has very low uptake by the brain and is useless in comparison to CDP choline, alpha-GPC or centrophenoxine for brain function and cognitive enhancement. For people using nootropics, a recommended dose of choline is 1000 mg per 4000 mg of paracetam per day. Individual requirements may vary. Too little and you may get a headache or brain fog from racetams or other nootropics that make the brain work harder. Some people can have side effects such as trouble sleeping, insomnia, headache, constipation, diarrhea, nausea, stomach pains, blurred vision, chest pains if they consume too much choline. L-alpha-glycerylphosphocholine, or alpha-GPC, is a natural choline compound found in the brain. It's also a parasympathometric acetylcholine precursor, which has been investigated for its potential for the treatment of Alzheimer's disease and other dementias. Alpha-GPC may also have a number of interesting side effects that cytocholine doesn't have. Taking alpha-GPC could lead to improved vitality and increased strength, as it helps muscles recover after exercise. Alpha-GPC may also increase the production of growth hormone in the body, while at the same time acting as some bit of a weak stimulant. Cytocholine CDP, on the other hand, may have other benefits that alpha-GPC doesn't have. One of the most talked about is the possibility of amplifying the effects of other nootropics. It's possible to take 500 mg of both CDP choline and 500 mg of alpha-GPC throughout the day for the combined benefits of both. Centrophenoxine is derived from DMAE, or dimethyl aminoethanol. However, new research shows that DMAE may not be a good idea for choline enhancement of nootropics. However, centrophenoxine combines very well as a choline source with the nootropics. Common doses are 1000 to 2000 mg per day. Centrophenoxine was also known as meclofenoxate, and it's a cholinergic nootropic used as a dietary supplement to alleviate cognitive symptoms of dementia. Centrophenoxine helps to boost cognition and memory, and it has significant anti-aging benefits, preventing and reversing neuronal decay. Some recommend taking centrophenoxine with 5 days using it and a 2-day break. Some users report that it's being easier to socialize and it increases verbal fluency when you take centrophenoxine. Centrophenoxine is not advised during pregnancy, as new research appears to show that the centrophenoxine robs choline from the muscles and gives it to the brain. Therefore, similarly, short-term use of centrophenoxine would only be recommended in combination with regular use of alpha-GPC or CDP choline. Some recommend taking acetyl-L-carnitine at 1000 mg per day with your nootropics. They say this helps to prevent the tolerance and the side effects that some people can experience after months of nootropic use. Acetyl-L-carnitine has two main benefits. It boosts brain power. The acetyl-L-carnitine is an anti-aging nootropic or a smart drug, meaning it helps your brain to perform better. The acetyl group on it lets it past your blood-brain barrier and it reaches your brain and your nerves, where it can improve your mood, your learning and your memory. Chronic acetyl-L-carnitine administration alters brain energy metabolism and it increases noradrenaline and serotonin content in healthy mice. Some also advise that you ensure that you reach your recommended daily allowance of potassium for the same reason.